Let me present a few cases of lymphadenopathy. So first case, on examination of the patient, I found that the patient has generalized lymphadenopathy involving the cervical, axillary, and inguinal chains. The lymph nodes are of variable sizes. The largest one is situated in the right anterior axillary line, which is about 3/2 centimeter. The lymph nodes are non-tender, discrete. The consistency is firm. They are not fixed with the underlying structure or the overlying skin. There is no discharging sinus. So based on my presentation, what do you think is the diagnosis? Pause for a moment. Yes, this is a case of lymphoma. So how did I present my case? I always keep in mind the 6 points. What are the 6 points? STD and CFD. STD is the size, then tenderness, then discreteness. Size, tenderness, and discreteness. The CFD are consistency, fixity, and discharging sinus. Consistency, fixity, and discharging sinus. STD and CFD. Let me present another case. On examination of the patient, there is lymphadenopathy involving the right anterior cervical chain. There are multiple lymph nodes of variable sizes. The largest one is about 2/3 centimeter, 3/2 centimeter in the right anterior axillary chain. The lymph nodes are non-tender. Some of them are matted and some of them are discrete. Consistency is firm. They are not fixed with the underlying structure or not fixed with the overlying skin. There is a single discharging sinus over the largest lymph node. So what do you think is the diagnosis? This is a case of tuberculosis or a case of tubercular lymphadenitis. So in this case, the most important points are, first of all, the mattedness. The lymph nodes are matted. Some of the lymph nodes are matted, and then there is discharging sinus. 2 words, matted and discharging sinus. Now let me go to the third case. On examination of the patient, the patient has lymphadenopathy involving the left supraclavicular and left anterior cervical chain. The lymph nodes are of variable sizes. The largest one is 3/3 centimeter, situated over the left supraclavicular region. The lymph nodes are non-tender, but the lymph nodes are non-tender. They are discrete. The consistency is firm to hard, or the consistency is hard. They're fixed with the underlying structure, but they are not fixed with the overlying skin. There is no discharging sinus. If I repeat the presentation, on examination there are multiple lymph nodes in left supraclavicular and left anterior cervical chain. The lymph nodes are of variable sizes. The largest one is 3/3 centimeter. They are non-tender. They are discrete. The consistency is firm to hard, or you can say just hard. The consistency is hard. The lymph nodes are fixed to the underlying structure, but not fixed with the overlying skin, and there is no discharging sinus. So based on the presentation, what do you think is the diagnosis? This is probably a case of malignancy. So there is secondary metastasis to lymph node, or you can say lymph node metastasis or lymph node secondaries. So those are the cases that you will encounter in your clinical practice or in your exams, and those are the things that you have to say when you present a long case or when you present a short case. Good luck. Bye-bye.